Okay, great. So maybe we'll get started. So thanks everyone for joining us. We're really excited to talk about health equity in COVID-19. And so we wish that we could be together in person or in a more dynamic way, but thrilled we can do this by Zoom and have people from Canada and the US here. So maybe by way of a warm up, we could start with a question for the audience. So I'd love for you in the chat to share with everyone, 18 months into the COVID pandemic, how are you doing? How are you feeling today? And so I'll give you 20 seconds to write down 3 words, and then I'll get you to post those in the chat, and we'll do a bit of a word cloud so we can see how people are doing.
So, Tim, this is Dr. T. Can I make a friendly amendment to that?
You can.
For the audience out there, don't hit return. Put as many words, not just 3. Whatever word, just separate it by a comma. Just don't hit return yet. And then, Tim, when you get ready, do a 5, 4, 3, 2, 1. They'll all hit return together, and we'll have the waterfall.
Okay, and, great.
I got a staff person, Meg Jordan, who's going to build the cloud for us. So keep those words coming, scholars.
Okay, maybe another 10 seconds to put your 3 words in, and then I'll tell you when to hit send. So, Dr. T, do you want to do the countdown?
Just more than 3 words, people, more than 3. 5, 4, 3, 2, hit return. There we go.
Great.
Amazing. And Meg will work on building the cloud. She'll let us know when it's ready.
Perfect. So while Meg is building the cloud, so again, we're going to be talking about harnessing change and what pursuing health equity looks like out of the COVID-19 pandemic. And a few housekeeping things. So we'll divide our time today into, we'll do a round of introductions. We're going to talk a little bit about the collaboration and the toolkit that we created with the Communivax team. And then we want to spend most of the time in a discussion hearing from the Communivax team, and we'll talk a little bit about what it's been like to sustain health equity over the last few months. And so we will make a recording of this available after the webinar. We'll also send around a link to the toolkit in the next few days. We're going to do a Q&A at the end of the sessions, so please feel free to submit your questions and we'll get to those. And then finally, just because it's a large crowd today, we've turned off cameras and microphones. So the Q&A is the best way to communicate with the group. And so, Meg, before we get started, maybe I'll turn it over to you if that word cloud is ready.
Not quite. Give me one more sec.
Okay, great. So we're still waiting on that. I'd like to start with a land acknowledgement. So Bridgeable is a human-centered design firm. We're located here in Toronto. We acknowledge that we are on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people. It is now home to many diverse First Nations, Inuit, and Métis people. We also acknowledge that Toronto is covered by Treaty 13 with Mississaugas of the Credit. So in Canada, tomorrow is our National Day for Truth and Reconciliation. And so, we're really honored to be on the land today and talking about health equity, which I think is a really important part of understanding structural racism. So, grateful to be here today and also to be talking with our colleagues who have a ton of expertise and experience in this space. And so before going into intros in the word cloud, let me just give you some context for the project that we're going to talk about today. So in the spring of 2021, so this year, we worked with Communivax and the Maryland Center for Health Equity on a project that sought to boost confidence and access to vaccines in Black and Latinx communities in the US. And so what we made during that collaboration was a toolkit called the Community Health Access Toolkit. And it's a step-by-step guide for community leaders to convene their communities and talk about and have conversations about extending health equity and access as a result of community-led responses to the COVID-19 pandemic. And so we made it because COVID was not a cause of longstanding gap and vulnerability in health equity and public health systems. but it really revealed some of those longstanding gaps. And so with our partners, we were really interested in this question of how communities, how we can engage folks in looking at the innovative solutions and ways community planning and community-led initiatives to the pandemic have actually been really important windows in finding new ways to create more equitable and accessible healthcare for everyone. And so I'll go into introductions, but let me check to see with Meg if that word cloud's available.
Yes, let's go.
Great. And so the size of the text shows how many submissions there were. So interesting to see. Folks are feeling a mixture of blessed and hopeful, optimistic and tired, stressed, missing human touch, good, privileged, hopeless, thankful. So I think many of us at Bridgeable would feel those things as well. And we really appreciate you sharing with us how you're doing in this difficult time. So let me start our round of intros. So Meg, I might just take this screen back. Great, so I'd love to start introductions by introducing my colleague, Emily Bronson, who is an associate professor at Texas State University. And Emily, maybe I'll turn it over to you to talk a little bit about your research and role in Communivax.
Thank you, Tim. So I'm one of the co-leads of Communivax, along with Monica Schock-Spana, who's at the Johns Hopkins Center for Health Security. Communivax is a national coalition of social scientists, public health experts, and community advocates. We are working to broaden COVID-19 vaccination coverage within Black and Hispanic Latino communities, and to strengthen the control that these communities have over the trajectories of their own health and wellness moving forward. In addition to a central working group and partners like Bridgeable, we have 6 local teams who have been working with communities in 7 sites across the United States for about 9 months at this point. Building on their existing relationships within these communities, the local teams have conducted inductive qualitative research with community members, leaders of local grassroots organizations, advocates for BIPOC communities, as well as local and state public health and government officials. The local teams have also actively coordinated outreach and built relationships within their communities to both improve vaccination uptake and to enable sustainable change and health equity moving forward. To date, the coalition has produced 2 national reports, 5 webinars, and various tools and resources to assist those in other areas with their vaccination and health equity efforts. We're thrilled to be joining you today to discuss one of the tools that we, and particularly our team, our local team from Prince George's County, Maryland, collaborated on with Bridgeable. So back to you, Tim.
Great, thanks so much, Emily. And if any of you have ever done multi-site, complex, cross-site reports, like 1 a year is like pretty taxing, 2 a year is like wild. So this team has been incredibly hardworking and fast-moving, and it's been super inspiring to see the really great work they've done. And let me turn it over to Dr. Stephen Thomas, who's a professor of health policy and management at the University of Maryland. And also with Dr. Thomas today, we've got 3 community health workers and barbers and stylists in Fred, Mike, and Katrina. So Dr. Thomas, let me turn it over to you to introduce yourself and your group.
Well, Tim, thank you so very much. It's exciting to be here today. I call this our international conference. Earlier today, we did a national conference, and I'm sharing that because of the humble beginnings of this project, working in barbershops and beauty salons, transforming them into trusted information centers. You're looking at 15 years of trying to understand how to address health disparities in racial and ethnic minority communities, how to address the structural racism that's out there that's impacting health outcomes. And for the initiative we're going to talk about today, Mike, Fred, and Katrina have been part of an amazing program called HAIR, health advocates in reach and research. And we were focused on chronic diseases, colon cancer, hypertension, diabetes, and then the pandemic hit. And we made a pivot to infectious disease, and more importantly, a pivot to addressing the conspiracy theories and all the other misinformation out there. And so you're going to hear from Katrina Randolph and Mike Brown and Fred Spry. And what I would like to do is have them, so you can hear their voice and we'll make sure their sound's working. Let's start with Katrina. Katrina, you want to introduce yourself?
Hello, everyone. My name is Katrina Randolph. I'm part of the HERE Network. I'm also a certified community health worker through the state of Maryland. And I own and operate Trey Shades Hair Studio in Capitol Heights, Maryland. And I've owned my establishment for over 22 years now.
All right. All right. They call her the short-haired queen. Okay. Fred Spry, you want to introduce yourself?
Yes, my name is Freddie Spry. I'm definitely with HERE as well, HERE Advocates in Reach and Research. And been working with Dr. T almost 11 years, working on the health disparities of the community and doing a lot of community outreach. I'm also certified public health worker as well.
Hey, Fred, you know, on the wall, you have that magazine cover.
Yeah, you want to see it?
Yeah, show the audience that magazine cover.
Can you see it?
Yeah, we can see it. The doctor is in. Okay. And it's not Fred being a doctor or playing a doctor. It's real physicians and real health coming into the community. Okay, Fred, I'm gonna put you back on mute. And Mike, you want to introduce yourself?
Hello, everybody. I'm Mike Brown. I'm a certified community healthcare worker by the state of Maryland. I've been with Dr. T for a little over 10 years now. Love what we're doing. The program is growing. Been a manager here at the Shop Spot for about maybe 8 years, and just love what we're doing. We're trying to keep the community safe.
Thank you, Mike. And you're going to be hearing more from Mike and Tim. We're going to take your audience into their shops so you can see what they're doing. And depending on when we come up, Mike literally had somebody in his chair today, just before we started, who was sitting there on May 17th, the first time that we did a COVID vaccine clinic in needles and arms in a barbershop anywhere in the state of Maryland. And the fact that the person who was in his chair on that day was in his chair today, just let you know, this is how we continue building relationship through the trusted infrastructure in barbershops and salons. I'll turn the floor back to you until we're up again.
Great. Thanks so much, Stephen. And thanks so much for Katrina, Mike, and Freddie for joining us. We appreciate it.
Definitely.
So maybe we'll start out by doing a quick overview of our collaboration, and we'll have a look at the toolkit. We're not going to go super in depth into the toolkit, but we do want to show you what it is and how you can use it. And then from there, we can just get into a broader conversation. And so we started last fall sort of working with Emily and Monica and thinking about how we might be able to support their Communivax work. So we read their first report and we're super interested in it and thought it was really important work. And they mentioned human-centered design. And so, one of the things that we do a lot of is thinking through how do you communicate about health information for organizations. And so initially we thought about creating a workshop in a box for the Communivax sites where we might be able to compile best practices around communication and access around vaccines and sort of package that up and provide it to other cities so that they'd be able to have sort of a best-in-class toolkit to get their vaccine campaigns up and running. And then the timeline of the pandemic really was not going to work there. So we started our active work in late winter last year. And at that time, the vaccine campaign was really speeding along. So in the fall, when we started scoping, the FDA was just doing emergency use authorization and the timetables weren't super clear. And so by February and March, communities were really in the middle of rapid planning for how to bolster access and information about vaccines. And what we were seeing is that communities themselves, and PGC is a great example of this, really had smart, innovative ways to build confidence and access really, really quickly. And so the project that we scoped just wasn't going to be helpful. And so with Dr. Thomas's group, we started thinking about what would bring value, what would actually be helpful to communities in the Communivax Coalition. And what we started to see was that over the last, the first half of 2021, there was a lot of resource and attention that went into communities in terms of people wanting to provide resources to have access to vaccines. And so the rapid planning and the ways in which communities spun out really innovative programs quickly sort of prompted the question of, there's an opportunity here to sustain health infrastructure and really, positive community-based planning capabilities. What's the best way for us to do that? And so with the PGC team, we set out to build a community engagement workshop that we wanted to use to convene really diverse stakeholders in the community, from grassroots community partners to people from the public health and hospital systems, in order to identify strategies to carry forward positive gains in health equity and community planning. And so, the Communivax group really brought months of really rigorous research. And so we really framed it around, how do we use design as a way to facilitate impactful community conversations? And so we were able to use the Communivax data to create a toolkit and a workshop format that was really focused on confirming what the biggest barriers to access were in the community, prioritizing what were the really innovative initiatives that the community had got off the ground to respond to COVID. And going forward, when we think about health systems more generally, what are the really high value ways to sustain some of those gains and put them to use against other community health problems? And so I think when we talk about community engagement, we're sort of like narrowing in on a world of community-based health research. And so I think it's worth just sort of stating explicitly up front some of the theoretical underpinnings or things to really keep top of mind when we talk about community engagement. So number one is there is really strong evidence that social determinants have significant influence on health outcomes. So it's really hard to talk about health outcomes at a population level without talking about equity. And so you can really imagine this, I'm sure, from your own life in accessing a vaccine. If you live in a community where you've got a high allotment of vaccine, if you work in a way where you can flexibly take time to go get a vaccine midday, if you've got a trusted healthcare provider that you talk to regularly who's able to give you information, or a trusted community member, those are all things that not everyone has, and really would mean it's much easier for you to get vaccinated than other people. And so these sort of social determinants are really important in understanding health outcomes. The second thing is the Communivax research demonstrated that hyperlocal responses to the pandemics result in much better health outcomes. So communities that were able to really tailor interventions to the specifics of their communities and involve sort of long-standing grassroots relationships are highly effective at getting better health outcomes. And I think the third thing here is there's a real opportunity to harness the power of hyperlocal responses to the pandemic, beyond just the pandemic, right? So there's a lot of cool community infrastructure that's been formalized or funded during the pandemic. And there's a huge opportunity to harness that to build more effective, accessible, and equitable health systems. And so in terms of what we created against this backdrop, so we made a toolkit called the Community Health Access Toolkit. And it's really intended for community leaders to convene diverse stakeholders in having this conversation around how do we sustain positive gains in health equity and community planning. And so we built it in collaboration with Communivax and the Maryland Center for Health Equity. And so we really built it with the Maryland team. We ran a first workshop and learned a bunch about it, and we iterated it. And I think what you'll find online is sort of an in-progress toolkit. And so, we saw our role as Bridgeable as really facilitators. And so we leveraged human-centered design to take some of the Communivax data and turn it into a journey map of what it was like for different community members to go through the process of getting a vaccine. And so we thought that by doing that, we'd be able to use the data in a way that would be accessible to community members. It's not technical reports, it's highly visual and put all in one place. And it helps people to get sort of clear on prioritizing what were the big challenges that we were facing at the beginning, what were the really impactful, inspiring things that we did, and what do we actually want to sustain, like moving past the middle of the pandemic, that we think we could use more generally for health in our communities. And so we really made an effort to design materials in a modular way so that communities are able to input their own data and adapt the toolkit to their context. So no two communities are alike, hyperlocal responses are really important. And so we wanted to build something that was durable and work in different community contexts. And so I'll show you quite quickly what is in the toolkit. So we built it from the perspective of a community convener actually wanting to run a workshop. And so we broke it into 4 stages. So the first is initiating a workshop, the second is designing the workshop, the third is facilitating it, and then the fourth is sharing it back to the community. And so in the first phase, we've got some tools to help conveners really determine who's your workshop for, who's going to be convening the workshop, and what does success look like. And so these are kind of table stakes things, but I think really important to define who are we trying to engage, who can bring them all to the table, and what does success look like at the end of our workshop. The next set of resources we have are around actually designing the workshop. And so here on the right, you can see at the top a template for personas. And so you can't really talk about community members in a heterogeneous way. And so personas are a way where we were able to take the research from CommuniVax and look at different sort of ideal types of people who have really different goals and motivations and values. And it's a way to really humanize data and also sort of focus conversations about health around people and folks who are actually seeking to access services. And similarly, we created journey maps. And so we showed how would a persona go from contemplation to preparation to actually receiving a vaccine. And the journey map allowed us to plug in the CommuniVax data to really look at what did the research show as the significant barriers in the communities, what were the really exciting initiatives that the communities launched to overcome some of those barriers, and sort of gets people towards what do we want to prioritize going forward. And so in the middle, you'll see a create barriers and initiatives worksheet. And so that was sort of the way in which we were able to take data and put it into the journey maps to make sure that they weren't based on guessing or wishful thinking. They reflected the findings in the community. So once people have designed the stuff they want to bring into their workshop, we have a facilitation guide. And so it's got different roles and responsibilities to assign for the workshop. It's got personas and slide decks and other tools that people would actually need to run a workshop. And so we really wanted to take the work out of preparing for a workshop and just have ready-made materials that people could harness. These things take a lot of work to put on. And so we really wanted to minimize some of that work. And so that sort of allows people to run their workshop based on the journey maps and personas they made. And then the final thing is some synthesis templates that allow people to look at what did we learn during the workshop, what do we want to carry forward, and what's the next step in terms of what we want to do with this information. And so a question in the audience was talking more about creating personas. So I think personas are a really good way of thinking about data. And so rather than assuming everyone's coming from the same place, we were able to use a persona that we created like Omar. And we were able to, with Omar, show that he's really motivated by job security and sort of the early stages of his career and getting in a union for health insurance. And then he's got a number of frustrations as well. And so by having several personas, it's a way of humanizing sort of some of the data around barriers and enablers. And also when you get to a journey map, it helps from keep assuming that everyone has the same needs. It helps us sort of identify what might work for Omer versus Stephen could be quite different. And it helps us make sure that we're sort of prioritizing things that are relevant to a larger number of people. And so at this point, we'll send the toolkit link along in the coming days and really excited for people to have a look at it. And so far, we've really talked about the importance of community engagement in the pandemic response, the opportunity to extend gains in health equity and community-based planning, and the toolkit that we created to help community leaders do that. But I think for the rest of the time, we'd really love to talk about what community-based planning and really exciting hyperlocal strategies look like on the ground, and what it looks like for communities to sustain these strategies and apply it in human terms. And so with that in mind, I will stop sharing my screen and we can jump into a panel discussion. So Stephen, maybe starting with you, I would love to hear from you what the pivot to hyperlocal looks like in your community and how some of the relationships and existing plans that you had really helped you to do that.
Well, Tim, first of all, thank you very, very much for that overview, because you made it look, everything was so nice and neat. I want your audience to know when we got into this, it was messy and confusing. And that's what helped us discover new things and new ways of thinking about how to engage the community. So I love this human-centered design approach. And like you say, we also brought the community in and we let them go through it. And they had to learn new skills inside these Zoom spaces. And guess what, Tim? It works. We left people with a sense of new skills that they had. And so what I would like to do is to pivot in this conversation so that your audience can actually meet the folks on the ground where we have built these friendships, relationships that we think is a game changer. How are we doing on time, Tim? We good?
We're good. We got about a half an hour.
Okay. All right, guys. We got a half an hour. I'm gonna take this audience into our world. And so buckle your seatbelts. And here we go. Let me see if I can share a screen here. It looks like I can. And I want you to tell me if you can see what I see. Here we go.
We can see a PowerPoint deck here.
Okay, so you see your splash screen here, harnessing change?
We do, yeah.
Okay, and now you see the word cloud, right?
We see the word cloud.
Okay, this is what the audience is feeling. Mike, Fred, Katrina, look at this. You may have had a word in here as well, but speak to what you see in this cloud of what this audience is going through right now. What do you see?
I see the tired in the middle. I'm definitely that as well. They're stressed, exhausted. They're productive. They're optimistic. It's a little bit of everything going on.
Katrina, what do you see? Go ahead and mute Mike. Or that might be Fred. Fred, mute.
That's Fred. That's not me.
Katrina.
Hopeful, excited, happy, grateful, ready, active, relaxed.
Okay.
That kind of speaks to me right now.
That speaks to you, huh?
Yes, for sure.
Fred, what word in here speaks to you?
Oh, it's a few of me. At times, hopeless, stress, ready, because I'm all about solution, optimistic as well. And tired.
Okay. Hey, Emily, you know this audience. What do you see here? What do you pull out of this word cloud?
I mean, the one that stuck out to me because it was the one I answered was tired, but I love the optimism that's also included, that things can still be hopeful. And so we're all in this situation that's tricky, but there are things that we are doing and can do to make it better. So I love the optimism.
Yeah, indeed. I see the word wiser, and I want to tell the audience that one of the discoveries we've had going into the inner city, when you look at your epidemiology, some of the toughest neighborhoods, highest COVID rates, lowest vaccination rates, high poverty. When we go into those neighborhoods, we've learned somebody lives there. Somebody loves their neighborhood. That's the attitude we need to go in with. How do we find assets and not just deficits? And one of the assets we have found is the barbershop and the salon. So I bring you greetings from the University of Maryland School of Public Health. And Emily, we just released our report back to the community last night. And one of the outcomes was, how do you stand up a sustainable innovation that has come out of our experience? And we're going to share with you that innovation, which is called hair. health advocates in reach and research. You see here are 4 main outcomes. Maybe later in the discussion, we can talk about some of these. I want the audience to know that I took all the epi slides out. We spend a lot of time on disease burden, causes of death. This suggests we need to focus on those factors outside of the biomedical model, cultural factors that includes breaking the cycle of poverty, eliminating environmental hazards in homes and neighborhoods, and more importantly, tailoring the message to the community. There you go, Tim, tailoring that hyper-local message. And remembering that many of these communities have historical reasons why they distrust us in the public health and healthcare sector. The Tuskegee syphilis study comes up often. And as you can see here in this image, this is a survivor of the Tuskegee study with President Bill Clinton. As you know, the study took place 1932 to 1972, but it was not until 1997 that there was an official apology. And I was honored to be in the White House for this apology. Mr. Shaw there is in his late, early 80s. As you can see, the quote from the president, that people who ran the study diminished the stature of man by abandoning the most basic ethical precepts. They forgot their pledge to heal and repair. They had the power to heal the survivors and all the others, and they did not. Today, all we can do is apologize. Tim, I'm so glad you talked about the reconciliation, truth and reconciliation going on there in Canada. We're all having this reckoning, but an apology means I'm sorry. In this case, from a president who wasn't even alive in 1932. We need to move towards atonement, which means making things better. And so that's one of the editorial cartoons that ran in newspapers when the study stopped in July of 1972. And we used the lessons, Emily. We use anthropological lessons. What are the cues to move these people? And we use that information not to empower them, but to get them to do what the scientists wanted, get them to sign consent for autopsy. So we fast forward here to our program. You see the wellness warriors and health advocates, a whole different way of reaching our communities. And as you can see here, Maryland Barbers and Stylists United for Health. And I think it's time. Hey, Tim, can I take them into the barbershop? Can I take your audience right into the shop?
For sure.
So they can see firsthand. Let me see if I can make this work. I have to come out and come back in. And Mike and Katrina and crew, this is going to take you back. This is going to take you back to some of our early days. And do you see a Muslim woman in a full screen?
We do.
Okay, I'm gonna start this one here. And here we go.
But the center as a whole can also has individuals that are interested in a variety of kinds of research. So one of the examples is getting people in and getting them screened for colorectal cancer, for example. And so Dr. Thomas and Dr. Garza have been leading that effort out in our hair network, our barbers and beauty shops, to get people in and encourage them to get screening. And the nice thing about that project is that we know, number one, screening for colorectal cancer is actually enormously helpful in detecting it, and in fact can, with minor polyps found during a colonoscopy, can actually take care of those and reduce the risk dramatically. It's critically important to build trust before starting a research project. And I think that's one of the benefits of the Maryland Center for Health Equity and the fact that the National Institutes of Minority Health and Health Disparities recognize the importance of having community engagement and research and supports that.
We asked the community when we started off, both as a center, office, institute, what is it that you think we ought to be doing that we're not doing? Nobody understands that better than people like yourself, the people who are in the community, because you're experiencing these disparities that we talk about. You get people in here all the time, probably sitting in your chair, talking to you about the kinds of things that go on that we wouldn't even know about. But the fact that you're willing to do what you're doing and then talk to people like Dr. Thomas and some of the other folks, what happens with what you tell them is that they take that information back to their universities and to their laboratories. They convert that conversation into good science.
Let me stop right there on that one. That was the director of the National Institutes of Minority Health Disparities in a barbershop, Tim. I told you it doesn't matter how much hair you have, you're going to spend time in the barbershop. But he got it right. What Fred, Mike, and Katrina tell us, we turn into good science. Hey, Fred, you remember that? You're muted, buddy. There you go.
I remember that like yesterday. It was amazing. And that was a real big day as well. But yeah, I remember that moment, and I remember, and everything since then has been growing so big from just what you guys been teaching us, and it was with the clients.
So we have, when we're able to bring leaders like Dr. Ruffin, you saw the scientist in the white coat in that clip. She was collecting microbiome, DNA. We're bringing basic science research into the community in a collaborative way. And one of the things that you helped us do, Tim, with the human-centered design approach is how to look at these personas, how to focus on solutions, and how to build empathy. And I want your audience to know that we were doing this work before the pandemic, but it really took a pandemic for the hyperlocal and the need for partners and friends to come to the forefront. So we've come from the margins, my friend, to the mainstream. And so you got a little flavor there. And I want to show you something that Mike did in terms of what happens when somebody's actually sitting in that chair. In fact, you had Omar in the human-centered design setup you showed earlier. And that person is a composite of one of the people you're going to meet right now in Mike's chair. This was done by the Washington Post, and it was a front page story. And the power of the video to help people understand what we're trying to accomplish has been extremely helpful. And so you should see a full screen here that says Washington Post. Is that correct?
Yep.
Okay, now watch Mike Brown. This is not made up. This is in real time. We just happened to have a camera crew there at the time. Here we go.
If they could come up with something for the coronavirus in 6 months, hell, cancer been out for 60 years. Why? How come they haven't came up with something for cancer?
These are viruses. They just take their course and they're gonna run. You can't stop them.
Mike Brown is a barber stylist.
What cancer and the coronavirus got to do with anything?
And a certified community health worker.
Bless you.
Hope I ain't give you the virus, Mike. You vaccinated.
I'm vaccinated, but that won't stop me from getting it.
You wearing your mask?
No question.
They said if you've been vaccinated, you don't have to wear the mask.
For months, he's been encouraging his clients to get the COVID vaccine.
You cannot get in my chair and not know that I want you to be vaccinated. I mean, it's all over my station. Because I turn everybody to the mirror for the shape up to see if it's straight. And when they look, their eyes always wander, or if they're not looking, I like switch the chair to here a little bit, so you'll look and ask the question.
Brown is part of a larger program called HAIR, aimed at bridging the gap in healthcare advocacy by tapping into the established relationships between barbers and their clients.
What happens in the barbershop is where social norms are set.
In a pilot program, the University of Maryland and Luminous Health turned this barbershop into a vaccine clinic.
Now we're down to the last mile. The last mile neighborhoods, the last mile communities. And you got to do things differently. It's not about volume.
We probably have vaccinated around 20 individuals, so it's small numbers, but those are 20 people who a couple of hours ago weren't vaccinated.
Brown sees this as the final stretch, where misinformation and distrust are still keeping some members of the community wary of getting the vaccine.
I think we weeded through the people who were on the fence. They've taken the position to get vaccinated. We're at the wall where people are saying hell no. and it's a difficult task. I can understand somewhat of a distrust, but it's a worldwide pandemic. The world is doing it, so they're trying to stop the world from reproducing. They're trying to put a chip in the world. They want to follow everybody around. I mean,
program leaders say providing convenient access to the vaccine will go a long way in closing the disparity gap.
So the access issue is really making it available, places where they come so they don't have transportation issues, no appointment necessary so they don't have to worry about how am I going to fit this into my schedule, how do I figure out how to get on the schedule, but basically just saying, hey, we're going to be here for 6 hours, show up.
And the hope is to expand this concept to other barbershops across the country.
if we did that in every barbershop where they allocated funds to every barbershop to do it on their off day, oh wow, that would be awesome. And so many communities would be reached. To chip something away from the hell no wall is everything to me. If I could chip one away from people who saying hell no, you keep fighting. You keep fighting. Maybe you get 2 or 3 the next time.
All right, let's give some snaps. Let's give some snaps from Mike. I mean, that was some serious communication strategies, how he avoided going down the rabbit hole of the cancer, how he, hey, Mike, how did you not say, I don't sneeze on me? I mean, that was just brilliant. You kept the conversation going.
That guy, we go at it all the time. He's a lifelong friend. He's one that's taking the position not to be vaccinated, and we go through it all the time. So I just didn't follow him down the rabbit hole about why they don't have a cure for cancer. And he has so many different analogies he gave me. He said, so they came out, HIV came out. Did you have babies during HIV? Well, you wasn't listening to them, so why are you listening to this now? I'm like, look, man, that has nothing to do with nothing. Let's deal with the facts. People are dying. We need to be vaccinated to protect ourselves and our families. And whatever your mistrust is, let me give you the information so that you can compare it with what yours is and then make an informative decision for you and your family. And that's the same basic analogy I try to give to all of my customers. And it's been quite effective. Some of them say, I'm still saying hell no, and you still got to roll, you still got to keep fighting.
So the key here is, Tim, how do you keep the conversation going when you have contention, disagreement? You have to have a relationship, because friends don't stop being friends just because you disagree with something. And so that's why these settings, I think, are ideal for change and finding solutions. Now, you know, I'd be in trouble if I didn't take you into the salon. Katrina's out there saying, well, the salons are different than the barbershop. So what about that, Dr. T? Right, Katrina? You're muted.
That's correct.
So I'm going to take you into Katrina's space. I'm going to take you into Katrina's space and give you an idea of how she does what she does to make a difference. And somebody's got to tell me how to get that bar from being in the way. How about that?
The Zoom bar is always in the way, Stephen. They designed it that way.
Okay, so let me know if you see somebody in a mask, full screen.
We do.
Okay, adjust your sound, buckle your seatbelts. Short-haired queen, we're going to go into her shop. Welcome to Shots at the Shop, and today we're at Katrina's Trey Shades Hair Studio in Capitol Heights, Maryland, which has been amazing.
My favorite part is saving lives, seeing people get vaccinated, because a lot of people are hesitant to get vaccinated. So if I can advocate and encourage them, I'm excited to do so.
A lot of people just don't trust the system. So we have to take the time to answer their questions. And what better place to do that than in a place they already trust?
They can dispel some myths and misinformation that's out there, and then they can refer them to others with more specific questions.
I've honestly seen about 25 to 30 of my clients go from, no, I'm not getting that vaccine, to sure, I'll get vaccinated or show up at your clinic on Monday.
I got my vaccination. I was comfortable with coming here. I actually feel comfortable here than I would at a normal clinic.
I like it because I know this place is not like it's not strange or anything.
You truly are, barbers and stylists, a trusted voice in the community, and we want to tap into your expertise and be a good community partner.
It's just for us to be knowledgeable in these health disparities so that we can have conversations behind our chair, because I believe that we're more than just a hairstylist. We're touching people just like doctors and nurses do.
Any barbershop that wants to hold a vaccine clinic in their place of business will find you a clinical partner.
So we can bring in all the clinical expertise.
I say just do it. Just work on saving lives, keep advocating for the community, bringing more people in, and I do believe that having a vaccine clinic at a salon is well worth it.
It worked here at Trey Shades, and it could work in your barbershop or beauty salon as well.
Yes, son, you're fully vaccinated. It was a great day.
All right, let's give Katrina some snaps. Let's give Katrina some snaps. That is not easy. And, when they're reflecting back on these things in an audience like this, it's more validation, Tim. I just want to thank you for being able to take your audience in. Hopefully they're putting questions in the box there. And so, Katrina, if you're there, turn your camera on and just share what's happening in your world in moving from vaccine hesitancy to vaccine confidence.
I think just being able to share informative information with our client base and just being able to advocate for them. So when they come into the salon and they're hesitant to get vaccinated, we just share literature with them. And if it get complicated and they think that we don't have the correct information, I try to refer them to the healthcare professionals, because I let them know that we're not the medical professionals. So we can give you the basic informative information that we have through research to help you make sound decisions for your life and your loved ones. So it's been a great experience.
And Tim, I think that the health professionals that we bring into the shops, that they get a lot out of it too. They're like really happy that they're finally meeting people before they end up in the emergency room or the hospital. Mm-hmm. So Emily, I'm so glad you hung out with us. You've been hearing us talk about this. One day I'm going to take you for real into the shop, but you just had a little tour vicariously. What's your thinking? And help us with any questions that might be in the chat from the audience.
Yeah, so one of the things that I think, and you're doing fantastic work, and Mike, Fred, and Katrina, it's been a pleasure meeting you and hearing and seeing your work today. I love it. More broadly with the national project, we found some of the similar issues in other places. So issues of trust or issues of on a community level, concerns that weren't being traced nationally. So, and there are also different resources. So in Idaho, rural Idaho, or urban California or in Maryland, things are going a little differently. And so we really need these hyper local approaches. And so having tools like the Hair Network, where you can use your barbershops and your salons to be able to have these conversations and bring the vaccines to the people is an important thing to start. And just going back to the toolkit that was developed with Bridgeable, the Communivax chat tool, we were really looking at this and using this, and this was one of the questions, to have an opportunity to bring community members together with public health officials, with government officials, those who are usually making the decisions and might not understand very well what's going on locally and with particular populations that they're not a part of. And so to bring everyone to the table and to have an opportunity for people's voices to be heard and to have planning occur that's really communal. And so it's not just decision makers making decisions, but it's the entire community making those decisions and plans together.
Oh, thank you. And Tim, in your opening splash screen, you had people standing in front of whiteboards with Post-its. Remember that?
Yeah.
Well, one of the things that we've learned working with you and Bridgeable and the human-centered design approach is that we have a COVID vaccine motivation board, and we take it to the street corners. We're standing in the street corner in Baltimore City and asking people outside of a barbershop, what's your motivation for being vaccinated? And they write it down on a Post-it and they put it up on the board. And we've been organizing those Post-its into themes, and they come down to family, protecting myself, protecting my community. None of it was about conspiracy theories. None of it was about infertility or any of these things. But the messages they said would move them to get vaccinated are not the communication materials I see coming from the agencies. That's where we have to, that's why hyperlocal matters.
That's a great point. So, Emily, I'm curious. I mean, during the pandemic, we all know people have spent a lot of time on messaging, but we know and evidence shows like the channel in which they receive that message and the person who's giving the message really matters. And I'm curious, in the research, what are sort of the common elements of like, quote unquote, good hyperlocal strategies that communities have put in place?
It really goes to exactly what's been Stephen and Mike and Katrina and Fred have been describing what's going on in Maryland, understanding what are the very local concerns and being able to address those directly. We can guess at a national level and say this is the issue, but locally, with the language and what are the specifics, you can have conversations that are much more meaningful. And the other part is, and just going back to the barbers and stylists that are working in Maryland, that, it really is these trusted voices and these people who, we see them regularly or all the time, and we trust what they have to say because we've trusted them about many things throughout our lives. And that is much more meaningful than, for example, a national messaging campaign that, somebody might see a poster or a billboard hanging up, or they might see something on the national news. Having it be addressed locally by people that and trust, that's a world-changing thing.
Hey, so Tim, we've been at this for 15 years. So I want to tell my Canadian friends, hey, Canada, no self-respecting Black barber would ever say I'd get you in and out in 15 minutes, all right? You're going to be there a while. So all shops are not the same. You want Mr. Jimmy on the corner who's been there for 30 years. He cuts hair and he's an owner. He cut your granddad's hair. He cut your dad's hair. He's cutting your child's hair. That's the relationship they have with their audience. And either those places can be super spreaders of conspiracy theories, because all kinds of conversations happen in the barbershop and the salon, or they could be trusted information centers where we can help people practice the COVID mitigation and address the underlying health disparities that is cutting our lives so short. So here's the message from the shops, my friend. Nobody wants to go back to normal, because going back to normal was not so good for everybody. And for many Black and brown people, back to normal means living sicker and dying younger. They want to go to a new future. And that's why I think the Bridgeable technology methodology is so helpful, because the barbers and stylists can be co-creators of their own solutions.
Great. Thanks so much for that, Stephen. So I know that we're coming up on close and that a lot of people probably need to head back to work. So I just really want to thank the panel, Stephen, Katrina, Freddie, Mike, Emily, for taking time to share learnings. And we really appreciated being able to collaborate with you on this and are really looking forward to sharing the webinar video and toolkit in the coming days. So thanks so much, everyone, for joining in.
You're welcome.
Thank you for having us.
Hey, you guys know what to do. Hey, Mike, you got some masks there for anybody who needs a mask? You got a mask in the barbershop?
I definitely do.
Yes, indeed.
We supply them with masks, sanitizers, and they know how to keep people safe. That's the key.
That's right. Big Sean.
All right. One last thing, Tim. We still got 47 people. Mike, what's the take home you want to send this audience?
Thank you guys for watching. Just keep being safe. just keep being safe. See you next time.
Okay. Hey, Katrina, what's the take home?
Protect yourselves and wear your mask at all times.
Okay, Freddie, you got the last word before I send it back to Bridgeable.
Let's keep this thing going, and let's do all our parts and stay optimistic and stay safe.
All right. That's right from the street corner. That's right from the street corner in a hot spot.
That's
okay.
Right.
All right, Emily, you got the floor.
Oh, I don't want to follow that up. Thank you. Thank you,
Okay.
everyone. It's been lovely.
Okay.
All
Take
right,
care, guys.
bye-bye.
All right. Thanks, everyone.
Bye-bye.
Take care.